Welcome. My name is Lisa Hermes, and I'm president of the McKinney Chamber. I think I know most of you, although there are a few new names that are joining us today that I'm looking forward to hopefully getting to know very soon. We are very excited about this topic. It's a very important topic that is very widely discussed, lots of information out there. Some of it's misinformation, some of it's good information. So we wanted to be able to provide to you, going to the experts and the people who are the most familiar with the ins and outs of the COVID vaccine, to answer any questions you have and really kind of learn more about this this new vaccines, I should say, and what we can expect and what's going to happen in the future. And so with that, I'm going to kind of get moving on with some few housekeeping items first so that we can really dive into this topic that we're very, very excited about. First is our Zoom rules. I feel like we've been Zooming for a year now, so most people know how we do this. So first of all, please rename yourself. Put your name and your company name. It is your virtual name tag, as we call it. So we know who's with us today and what company you are with. Feel free to chat with one another. If you see somebody that you don't know, reach out to them. I know in the good old days, back in 2019, we would be in a room together and meeting each other and sharing. And so we can still do that virtually, just a little bit different, but that's where that chat button really comes into play. A couple of other things too, please do remain muted so that we can hear the presenters during the program. And then also we're recording this. We'll be sending out a follow-up email with anything that we've discussed, some different websites and things that we want to make sure that we're sharing with you, as well as the recording of today's program. We want to get your questions answered as well. So please utilize the chat function. I'm going to be, looking at the chat. There's a Q&A portion at the end. Like I said, I've got lots of questions. So if I've got lots of questions, I know you guys do too. So we've got the experts with us today. Let's utilize our time with them. All right. So now my first order of business is to present to you our presenting sponsor, which is the Alliance of Elite Youth Leadership. I apologize. Our good friends, Sarita and Derek Robinson, who formed the organization and have been just a huge part of our community. Derek actually serves on our board of directors, so thank you for your service in that capacity. And I believe I'm going to turn it over to Sarita first, who's going to share with you a little bit about their organization and some of the things that they've been doing, particularly this year. Sarita.
Okay, thank you, Lisa, for having us on. It's always an honor to support here in the community and to be a part of the McKinney Chamber of Commerce. And it's an honor for us to be sponsoring the luncheon today. Derek Robinson, as Lisa mentioned, is with us, as well as Terrence Johnson, who is a part of our organization as well. So the Alliance of Elite Youth Leadership, known as AEYL, began as a community-first agency in support of teens ages 12 to 17 to explore, expose, encourage positive development traits, all done through a core four-pillar philosophy: mentorship, academics, athletics, community service. Building relationships in the community first was important to Derek and myself for strong advocacy and involvement, especially with teens and their families. AEYL has supported over 2,000 teens and young adults throughout Collin County since its establishment in 2013. In the past 8 years, with dedication, consistency through action, AEYL has become a community go-to agency for various resources, whether it be life skills offered to teens and young adults seeking guidance for future prosperity, workforce education and placement that stemmed from teens who have benefited from mentorship since the early years that they are now eligible for work. And AEYL provides an entry-level insight to the workforce as a partnering training center with TWC. Family advocacy and civic and community engagement as a liaison for understanding education to families regarding community development and engagement and vice versa. These needs incubated the Follow, Lead, Succeed Resource Center, which is a certified resource center located downtown McKinney, Texas, providing a host of resources. We are proud to announce our expansion to extend our services, hiring additional office staff to serve at a higher capacity. As a prelude to today's discussion about vaccines and COVID-19, AUIL has played a huge part in a pandemic relief for the community. When PPE was scarce, the teams from the STEM program within AUIL offered a solution by providing 3D printed face shields using the model from Columbia University, supplying over 1,000 face shields locally. AUIL was sought out by Marines Toys for Tots to participate in Toys for Youth and Teens approach for Christmas. Since the age group that seems to come up short on gifts, a toy drive specifically for these youth and teens through AUIL was coordinated, providing over 3,000 toys for teens in Collin County. COVID brought up tons of what ifs, what abouts, and should I's, which was one of the questions for lots of families when it came to in-person learning or virtual. Most students returned, but for those that did not, really need to and just were stuck in a hard place, needing an in-person support, but with the virtual access. AUIL implemented a 6 to 8 student environment where students could have virtual connections for school with an on-hand tutor for in-person support. Lastly, but certainly a key factor, food. In partnership with Community Lifeline and connections with USDA, AUIL has and currently orchestrates a community-wide food drive in McKinney, providing over 700,000 pounds of food distributed since March 2020. Feeding Friends and Families, which is the network, continues these efforts every second and fourth Saturday monthly. Again, we would like to thank you for having us on. We're looking forward to our speakers today so that we can be an extension of resourceful information about the beneficial factors of the vaccines available to the community. All information provided on these slides and more can be found on our website at aeyleadership.org.
Thank you, Sarita, so much for just, man, you make it sound so just smooth sailing when you speak. So again, thank you guys for having us again, Lisa and the Chamber, allowing us to be a spotlight sponsor. I would just more so talk about moving forward as things are starting to open back up and what AUIL have in place. We're honored to, be working with the Byron Nelson tournament that's coming up, to be a charitable organization, to give our teenagers an opportunity to get out and get involved and serve. We have a lot of sports programs coming up with NFL, football camps, and also just more scholarships for teenagers, seniors in high school getting ready to go to college. So we're gearing up our Monday night mentor meetings, and obviously continuing to build relationships with industrials and manufacturing and just companies in the area of Collin County to create apprenticeship programs for our teenagers to get involved and get experience in the workforce. So again, like all the companies, I think for us, the reason we soared so successfully is we collaborated, we pivoted the services of what we offer to make sure we can bridge those gaps in the community in a successful way. So thank you again for allowing us to be on as a speaker today. And I'm always, it's always honored to be around such leaders like you guys and to hear today about, COVID-19 and what to expect from the experts on the call today. Thank you guys.
Thank you so much. Again, appreciate both of you, Sarita, Terrence too. Good to see you. I didn't see you at first until we spotlighted the bigger picture. So thank you to the whole team and AEYL and for what you do. And I think it's just another example of our community, the great people and the organizations who we had before this global pandemic rocked our worlds, right? But the ones that were doing great things before and then pivoted during this year to be able to step up and meet the needs of people when they it came, when they came very quickly and address very specific needs. So thank you all very much, and thank you for sponsoring today. All right, so we're going to go ahead and dive right into this program, because I think that this is what we're all here to listen to and learn today. I'm going to introduce you first, Dr. Jeffrey Kerr. He is the Chief Medical Officer for Medical Center in McKinney. So he is joining us today, and I'm going to let him say a few words, kind of give us an overview a little bit about the vaccines. We'll get more into some of the details and get some of those more nuanced questions answered a little bit later. But please help me welcome Dr. Kerr.
Thank you, Lisa. And what a pleasure to be with you guys virtually this morning. A number of y'all we met yesterday briefly to prep for our panel discussion today, and it was delightful. So, and thank you to the Chamber for sponsoring this event and for your work to think about the community and take whatever resources and influence you have to serve and get us back to where we want to be. So it's a pleasure to be with you guys. I'm just going to take about 10 minutes to provide an overview of basically the issues related to vaccination, and we hope to leave time for specific questions and things like that. Let me just begin by saying it's such an important topic, and but it's unfortunate that the topic of vaccination for many of our community members is something that is seen as political, and like masking at sometimes and other matters of public health. And my goal today, really, I would fail if anybody left this brief discussion feeling scolded or challenged in any way other than in a really good spirit, which is I'm coming to you with science as a physician, and these are the things that I would tell my patients, my neighbors, and my family. And so, what a honor to be with you and to be able to share. First of all, some great news, and that is that across the country, COVID numbers are dropping. And I won't rehash the 24/7 news cycle, but here in our communities in North Texas, we are seeing our community transmission rates drop. We monitor the community transmission rates through a number of tracking sources, and here at Baylor Scott and White, and Collin County is still in the moderate to substantial transmission level, and that's not the lowest level. Hopefully we'll move into the low level soon, but that's all very encouraging. Similarly, in Texas, our vaccination rates are climbing rapidly. We are confident that the vast majority of the most vulnerable members of our population are folks age 60 and over, and especially our frail elderly 80 and over are getting vaccinated quickly. And we're kind of moving now to target underserved populations that are still not able to access vaccines, and you're going to see some targeted efforts there soon. You may have heard in the news that we've surpassed 200 million vaccines nationwide, which is really impressive. What I'd like to just point out today is my comments are going to be directed to those of us in our community who are statistically least likely to be contemplating vaccine, and that's our younger folks. So age 16 and up, but especially the 20s and 30 somethings, and among those groups, women of childbearing age. So women of childbearing age across all demographics are those who have come to get vaccinated at the lowest rates. Okay, so basically, I want to just draw a simple comparison with this particular type of vaccine, or give you a metaphor at least to compare the COVID vaccines that are commercially available, the so-called mRNA vaccines, that's messenger RNA, with the vaccines that so many of us are familiar with that we received in childhood: measles, mumps, rubella, chickenpox, pneumonia, those kinds of vaccines. And so it's really important for folks to understand that the mRNA vaccines that have been developed Pfizer, Moderna, are truly amazing products of science. That let's compare the mRNA vaccine for COVID to what we received as children. So measles, mumps, rubella. Those viruses, measles, mumps, rubella, the vaccines we developed for those viruses were inactivated viruses or viral particles or other things that we introduced into the body through a vaccine, and the body reacted to hundreds, if not thousands, of different foreign particles that were part of the measles, mumps, or rubella viruses, and and these generated immunity or protection from those childhood viruses. The difference between those and the COVID vaccine viruses is that the mRNA viruses introduce one foreign item into the body. It's messenger RNA, and that messenger RNA, we know exactly what it is. It's genetically mapped, and it's very precise. That messenger RNA comes into your cell, and you're using your cell's antibody machinery makes the antibodies directed against a very specific part of the COVID virus that prevents it from attaching to your body and causing serious disease. So I would want, if I could leave you with anything, it would be that this vaccine is incredibly pure, incredibly precise. It's like the smart bomb of vaccines by comparison. And so it would be wrong to call the measles, mumps, rubella vaccines as crude or primitive, but by comparison, they are. And so rather than viewing the mRNA vaccines with any kind of suspicion or worry, I would want to reassure everyone that they're amazing, amazing results of amazing research. And what's beautiful is that it's these kinds of vaccines that actually are the basis for some of the vaccine-based cures for cancer that we're seeing in certain types of cancer. So I'll stop with that, hopefully inspiring your confidence there, and just cite a couple of very recent articles that came out last week in the New England Journal of Medicine, the American College of Obstetrics and Gynecology, and another big peer-reviewed journal called Morbidity and Mortality Weekly. Basically, we're now at a point in time where we have gathered enough data about COVID vaccine. We have enough people who've been vaccinated and been vaccinated for a long enough time to watch them that we're confident that about 1 in 2,000 people who are fully vaccinated is even able to get COVID, but in an asymptomatic state. So the point here is that many of us, we asked ourselves, well, when can we start taking off masks and begin to socially gather once we're all vaccinated? Well, it wasn't until we had data that will begin to accumulate to show that if you're vaccinated, what's the rate of catching COVID, but without any symptoms, where you could harbor it in your nasopharynx and pass it on to someone else who perhaps wasn't vaccinated. And so now evidence is accumulating that we're very confident that the rate of asymptomatic carriage is the medical term, meaning I can catch COVID but not have any symptoms and potentially pass it on to someone else. The rate of asymptomatic carriage after complete vaccination is extremely low, like 0.05%. And that's wonderful news. And so I think that'll help us in the very near future, maybe even late April, May, we'll begin to see the CDC relaxing masking requirements for people who've been vaccinated. So I think I've taken up my time there. I'll catch us up. But again, for those of you who find yourselves kind of on the fence, or your colleagues or your neighbors or family members, I would please ask them to commit to the science. And if there are folks who want an authoritative source of information about the vaccines, their efficacy and side effects and this and that, and what peer-reviewed medical journals are publishing, There's lots of places they can go, but they can certainly go to the My Baylor Scott and White website, which is mybswhealth.com. We've got a great COVID vaccine resource that's very lay friendly for our members of our community. So just want to encourage everyone to learn about it. There's the website there. Thank you so much. And look forward to answering any questions you may have after all of our presenters have finished. So thank you.
Thank you. Thank you, Dr. Kerr. And wow. So yes, there's already lots of questions coming into the chat. So I'm very excited to get to those as well. I was excited to get right into this program that I failed to mention something very important that I think our audience would like to know that you can take advantage of. So while we're learning more about vaccines, there's still some other work that we can do to help protect our community. And one way is to get tested, right? And we are partnering with, let me make sure I get this straight, the Texas Department of Emergency Medicine. So the Chamber has free testing kits available to businesses. There's a little bit of a process. You have to watch a training video and get certified. But if you are interested in obtaining a kit for your employees, please let us know. It's in the chat where there's more information. We have on the line with us as well, Karen Ferris. She has been our point person on staff and can answer any questions about that. So I did want to get that out there for all of you to be able to access that if you need to. Okay, so now moving right along to our next guest that we have with us. We're very honored to have with us, and that is Rod Baker. He was actually part of the Moderna trials, which I find to be very fascinating. And he has a very unique experience that he'll be sharing with us. So Rod, thank you for being with us. Something else too that I wanted to share with you about Rod is that he too is a business owner. He has a professional DJ business and does lots of events. So his business and his industry was completely impacted by COVID-19. So he has a different point of view, I think, that we can all appreciate from the business community's standpoint, as well as his unique experience being part of the clinical trials. So with that, I'm going to turn it over to Rod. So Rod Baker, welcome.
Well, thank you for having me. As Lisa mentioned, my name is Rod, and I am the owner of DFW Parties. I have an event and lighting company here in the Metroplex. I am in the business of social interaction. So when we talk about everything that got shut down and everything that was affected, I was affected on a very, very profound level. So I loved Dr. Kerr's information, fantastic stuff. I love hearing, and I'm a junkie for information and just getting all the data that I can on things. But I also think it's good to have a perspective of your peer, of somebody who isn't a medical expert. I am a business owner, and I want to talk to you on that level of how I came about and how I dealt with it from a business perspective. But yes, I also want to talk about the trial experience and all that information as well. And again, like Dr. Kerr said, well, I think the real value here is in the Q&A, but I'll give you kind of the overview first. So for me, COVID showed up on my radar actually before it was in the news. It was the first week of 2020. Part of my business is lighting. And so I've dealt with China on a very deep level in terms of importing lighting products for the past 15, 20 years. So I place lighting orders. I either rent them to clients or I sell them to peers. I do things like that as part of my business model. And the first week of January, is probably the 4th of January, I was not able to procure a very large lighting order. And that's never happened. In 20 years, I'm never able to not buy a product from China. And the answers I was getting from the suppliers, and it was one right after the other, were extremely vague about not being able to get stuff out of there. So I wasn't really up on Chinese current events, but I started doing some internet research, and I saw a reference in a science journal that referenced what became later known as COVID-19. and thought, well, maybe there's something to this. And it didn't take more than a couple of weeks before things started getting more amplified, and started realizing right away that, hey, this is probably what's going on over there. So um, obviously with a Chinese controlled media, I was not able to get deep answers, but I knew things were challenging. So I was able to get a small lighting order in, and my supplier actually asked me if I wanted to order PPE with the product. Um, this is January. This is back when nobody had this kind of stuff. So I was like, yeah. I actually ended up procuring 5,000 masks. And in one of what I call my personal wins was when I received those. I have friends from all walks of life, all over the country and the world, in fact. But I had a friend that when everything got really bad in March up in New York, I was able to send 4,000 masks up to upstate New York back when nobody could get this stuff. So that was an honor to be able to do those type of things when those things weren't happening. So, but I knew pretty on this was going to be serious, especially when it hit Northern Italy. I think that's when it became real for a lot of folks, is that it went from, oh, it's in Europe. And so the bounce from Europe psychologically, I think, to the States became a lot more real than from Asia to the States, even though we were a very interconnected world. We knew right away this was going to be bad. So as a business owner, I try to be proactive. Okay. So one of the things I did, and all my peers were not really taking this as seriously as I was, but I felt very strongly that we're going to be having to move dates, whether imposed from our state, local, national governments, or whether their client would just be, spooked by the process and want to move the date themselves. Whether it was imposed or not, I felt like we were going to be moving a lot of event dates. So I was able to create a private web page within my website where I had my available dates from September 2020 onward. And I started contacting clients in February, and they weren't ready for this. They weren't ready psychologically for this. But as they were, I was able to shift dates very quickly, very efficiently, very easily. I was very fortunate. I would probably call that my biggest 2020 win, is that I was able to move 35 weddings into late 2020 and early 2021, and some of them even later. I only lost one date. I only lost one wedding that we could not reschedule. So I consider that a massive, massive win. Obviously, the second quarter, I went 12 weeks without an event. So when you talk about an impact on businesses, my company is a 6-figure company, and I've got a couple of DJs and a number of products. I made probably $1,000 in the second quarter of 2020. So it was a drastic impact. But I was confident about the future because I was able to efficiently shift everything forward, and I used that time to retool and rest. I do 75 to 80 events a year, and I actually was able to use the time to catch up on a decade's worth of sleep. So now at the same time, I had a group of friends. We created a sort of think tank. These were people among my industry, outside the industry, and we just sort of talked about the whole process and everything that was going on, one of which was a doctor. And this is when I first heard about what was called the COVE study group. And this is a study group for vaccines, and we didn't know which vaccine. When I applied for it, I did not know which vaccine I was applying for, based on, there are about 6 or 7 different companies vying for trials. And my secret hope was that I would be part of the Moderna trial, because that's where the headlines were. They seem to be making the most inroads. They were the ones in the headlines more than anybody else. So I didn't get in the study right away. They were slow, and it was gathering the number of people and gathering statistics and all this kind of stuff. I would say this would be about July. And so I wasn't hearing back. And I am, for lack of a better term, I'm persistent. I'm a pretty good salesperson. So I was on the phone more than they wanted to hear from me, I'm certain. I called them nearly every day and said, look, I'm not at home. I mean, I was very safe. I locked down, but I knew that starting on June 20, I was going to be doing a lot of events. I had no choice. I have to put food on my table. So I was going to be around a lot of people. And even though I had been safe and, doing the social distance, wearing the mask, we did not eat out during that time. We were among the most safe, if you want to call it that, safe people on the spectrum. But I was about to be thrown back into my company, which is social interaction in a very profound, very close, very enclosed space kind of way. So I knew that I wanted to be protected for this if I could, if it was on the table. So I called them virtually every day. I think I may have just beaten them into submission. They did finally let me into the study, and I'm pretty certain that what I do for a living is what got me into the study. I have estimated, I keep a rough total. I think since my second injection, I've probably been around somewhere north of 7,000, 8,000 people on a very, very close, in your face, dancing, screaming and singing at the top of our lungs kind of situation. This is the least safe of all the environments that we are, and I have not contracted COVID. So now the study itself was fascinating. I actually wanted to document this process. That's how I do my marketing. I show my dance floors. I show myself working. I show that it creates a situation where I receive a number of follows on Instagram and YouTube and all these things. And that's how I build an audience and sell to my clients. So I naturally wanted to document this process. I wanted to make jokes about when they put the injection in my arm, like, where does the chip go? I wanted to address and have fun with the whole process, and be lighthearted about it, but serious at the same time. And I actually was not able to document the process itself. I was able to talk about it away from the test site. I was not able to actually do that. They actually had concerns for security's sake about, the testing site. So, and I totally respect that. But as an industry, I guess a leader, I've had enough people come to me and say that, is that they've looked to me as a peer and as somebody who did it. They're not reading in an article and they're not hearing it from a quote unquote authoritative source, which I think is crazy. I think that's where you should get all your information. But a lot of people have come back to me and said, I'm doing this because I saw you do this. And I saw you do this safely. For me, I got my first injection actually on my birthday, September 3rd. That was the first available date, and I jumped on it, and that was very celebratory for me. Now, when we did the study, we did not know that there were any benefits until after the second shot. We didn't know this information. We didn't know what we didn't know at this point. And I had a mild reaction. I was very fatigued. I had an event on the 5th, 2 days after my injection. I got fatigued faster than usual. And so I thought, well, that could be a placebo effect. It might not. I don't know. So I did get my second injection on September 28th. Because of that, I was very cautious, and I made the second injection purposely on a Monday. So, because we started hearing word that, hey, there might be, I call it the vaccine hangover. I've had experience with a few hangovers in my life. So I call it the vaccine hangover. It really wasn't any more serious than that, but I am happy to answer questions about that. But yeah, it was real, and it was not a placebo effect. We had to, for the study group, take our temperature often, report that data on an app. It was very thorough, and I continue. I'm still in the study for another year and a half. This is an ongoing study for safety and for efficacy and all those kind of things. But when I felt crummy, I have to tell you this, when I felt crummy, I was so excited. I was so pumped because of the 30,000 trial recipients, 15,000 of them got a placebo and 15,000 of us got the real deal. So my temperature usually resides in the low to mid 97s, and I was pushing the low 100s. And I was laying there fatigued, and I couldn't have been more happy of my situation because I was very, very confident I had the real deal. Now, that being said, I had to deliver a product the next day. And that morning, I still felt pretty crummy. And I took a lighting product to one of my wedding planner colleagues. And she, because we all speak frankly to each other, she let me know how terrible I looked. And I said, yeah, the vaccine's working. What was interesting, though, I went back home. I kind of slept it off. At about 2 o'clock, I'm laying there feeling crummy. And it was almost like a light switch. Like I suddenly felt better again. Like I was like, oh, it must be working now. And so when I had to go back to that same vendor that evening to pick up that same product, she was like, wow, this is night and day. And I said, yeah, I think I might be immune now. And that's when the optimism sort of kicked in. And I think that's it. I mean, I don't know about you guys, but I have felt very powerless. All this stuff happening, especially from an event industry perspective, this was coming at us, and we didn't really have a say-so in the matter. We had to shut things down, and we didn't have impact. So for me personally, being part of the trial was taking control of the situation, doing something and fighting back about this and trying to, battle back. The intriguing thing to me was I was able to talk to the study doctors. You put me in a room and I'm really super social. I was able to talk to the study doctors in a very, I don't know, candid fashion. And I think they knew about the 94.5% efficacy, but they weren't ready to talk about that yet. It almost felt like they didn't want to overpromise, but I could see the enthusiasm when they talked coming from them, from the study doctors. We knew pretty early on we had a winner. I had no idea. Nobody had an idea that it was going to be that effective. But I knew right away, that we were looking good. It's fun to watch the stats drop of the infection rates. I feel like right now we're probably in a race of time with inoculations versus infections. I think if we can be safe just a little bit longer, we're going to get through this just a little bit more quickly. But I got to tell you this, it's fun to be in front of crowds again with a microphone and feel that full confidence that I felt before all this happened. And that's just recently come back. It allows me to do my job better. It allows me to be a better business owner and just more enthusiastic. I mean, I won't lie. I'm super optimistic, but when you can't do your job for 12 weeks and you're told by the world you can't do your job for 12 weeks, that's going to weigh. That's going to weigh on you heavily. So for me, that weight was lifted, almost instantly with that. And I will say this, I was exposed. I had a potential exposure. I was doing one of my events. This was in late October, where I was doing an event, and the security person from the venue was a friend of mine. He hung out in the DJ booth a little bit. Because it's so loud, we're talking like this to each other. And he calls me about 5 days later and said, dude, I've got it. I've tested positive. So when you're in the study group and you show that you've been exposed, you got to call them right away and go in and get a COVID test and get all that stuff because they want to know about the efficacy. Didn't get it. Did not get it. It's not asymptomatic. I still have never contracted this virus. It seems to be doing its job. I still mask up whenever possible, but for me to do my job, I need to be able to enunciate in a microphone and be enthusiastic. So I don't always get that luxury. But I can speak on a personal level and a business owner level that this is probably the most important thing I've ever done in my life. And I'm grateful for the experience. And I just want to share the experience with everybody. And, any questions that people have, I just really want to embrace and come at it from that angle. So I appreciate the opportunity to chat with you guys.
Rod, thank you so much for sharing, the multifaceted things that you went through in 2020. I think that we could all relate to that. And I think that, when you talked about feeling powerless, I think a lot of business owners that we talk to, people in the community that we talk to, not just business owners. I mean, obviously we're with the chamber, so that's who we interact with on a daily basis. People did feel that way, and I'm happy to share with the group too that thank you, Rod. I got my first Moderna shot not too long ago, and the sense of relief that I felt and stress that I didn't realize I had been living with for a year, like I just wanted to cry, and not because it hurt. The shot didn't hurt. It was just like, wow, I didn't realize how much we'd been having to deal with. And so
here's my analogy on that is I talk about people that have had braces. Okay. This sounds weird, but stay with me on this. If you've had braces and you get your braces off, the first thing you notice is that your teeth feel slimy. Okay. Well, your teeth were slimy before you had braces, but you never knew it until you had the braces on and then were liberated from them like that. So for me, the feeling of euphoria and the feeling to know that I truly am probably protected on this on a very deep level, and especially hearing the new data from Dr. Kerr here, that's how it always felt, but it feels so much better now, so much better.
Yeah, absolutely. So Dr. Kerr, I have a question for you. Well, first I'm gonna have a statement, and it's gonna then go into a question. And Amanda, our events manager that you've been working with to put this on, she reminded us yesterday, we talked about, having to get information out and people's hesitation with getting the vaccine. And she reminded me yesterday that, wow, we should be celebrating. This is a pretty huge thing that was a huge accomplishment in the health and science field, that we were able to deliver a vaccine in this amount of time. So, but because it was such a short amount of time, or it felt like a shorter amount of time than what normally vaccines are, how long it takes to get from concept to production and distribution. So that's given a lot of people a lot of pause about the process. Can you speak, Dr. Kerr, to the testing process? What was detailed, in this process, the trials? Was there anything that was short? Like, how did it come about so quickly, I guess is my question. And should there be anybody concerned?
Sure. Well, so I'll speak with, what limited knowledge I have. I'm sure somebody even on the meeting today may have seen a news piece or a documentary that has richer or better information, but I think what I know isn't incorrect, and that is that there were no, in terms of the rigor required by the Federal Drug Administration, the FDA, there were no shortcuts or reductions in the barriers necessary to move the candidate vaccines through the approval process. And what really happened is a wonderful kind of symphony of coordination between academic centers that had the relationships with the vaccine developers and the infrastructure for vaccine trials in place already, because they do drug trials and they can implement the exact same stuff on top of that. Plus, there were administrative reductions in terms of anything that was a non-safety related administrative barrier was removed. And then finally, all of the professional societies and subject matter expert groups that weigh in on vaccine recommendations agreed to put everything else behind them, meet on Friday, Saturday, Sunday, holidays, you name it, to accelerate bringing the vaccines to the market. So the takeaway there is that, except for the fact that all of the vaccines are still under what's called an emergency use authorization, and that means we are unable to declare them as anything other than available for emergency use based on our long-term surveillance rules. And so it's a label, but I would tell you that the rigor and the analysis and the ongoing study that is, and Rod's a part of that, right? He's in that ecosystem, should inspire everyone's confidence. Okay.
So yeah, kind of along that same line too. So I had read earlier on when I was doing my research as well, because I had some of the same questions and hesitations about the vaccine at first, and really learning more about the messenger RNA form of vaccine, and just really, well, in layman's terms, how cool it is of science. It sounded like scientists were already working on this kind of a vaccine prior to COVID-19.
That's
so
right.
Are we going to start seeing other vaccines move to a messenger RNA, or is measles, mumps, and rubella going to be, as you described earlier, that type of vaccine?
Yeah, so I'd say the historic vaccines probably won't be changed because they're so well studied and so established as being safe, even though they're a different technology. But you may perhaps recall the MERS, which is the Middle East Respiratory Syndrome virus that came out in the early 2000s. There was a vaccine. It's a SARS. It's in the SARS category, which COVID is in terms of the symptom complex that those diseases cause. So there were mRNA vaccines developed for MERS, and you'll remember Ebola. We all remember Ebola. There's a vaccine for Ebola now. While it's not an mRNA, the same advances in the underlying technologies that eventually made possible the development of mRNA vaccines were already ramping up. And like I said before, vaccine technology will probably be what some of our first cancer cures come from. And that's very exciting. But that technology's been spinning up for 15 to 20 years. What's amazing here, though, is that, again, our flu, we have a global flu surveillance system that the World Health Organization and others support. We have so all of the flu vaccine distribution pathways were utilized as well for distribution of the COVID vaccine. So there was existing infrastructure that was kind of co-opted to accelerate the COVID vaccine development and distribution effort. So you guys remember when the first monoclonal antibody therapies, the bamlanivimab, came out, and how that was getting distributed, and the remdesivir, which is an antiviral that was effective against COVID. So the distribution method, the procurement, the allotment, sending it out to the states, who then dispersed to hospitals and other endpoints, all that was recycled for COVID vaccine distribution. And so there was a cumulative thing that happened during COVID, but there was also a preparatory set of conditions that really made rapid vaccine development favorable. I'll tell you, and I'm not a coincidence guy. I'm all into fate. Things are fated, because I believe, behind it all is a benevolent, loving entity, and that entity wants to take care of the world and us, and helps us work together when we get in step, right? And so that's why two takeaways from this whole chapter for me are, number one, there's, depending upon who you listen to, right? And I'm not going to bash the mainstream media, but we all listen to social media and the broadcast media. Depending upon who you listen to, that's how you interpret the world you are living in, right? And so some of the sources would tell us that this calamity has brought out the worst in people. And it has been a crazy, 18 months. But if you worked where I worked and saw the people show up to work every day with not enough PPE and uncertainty, got their own kids home because they can't go to school, but they're coming up to the hospital, you'd realize that is a myth. Calamity brings out what is inside of people, and what is inside of people is pretty amazing. And so one of the messages, I think, like Rod was saying, we have this kind of reset or reboot pause that we pass through. One of the things that I realized, the sense of the loss of control Rod mentioned is real, but the other thing I realized is how interdependent we are. Oh my gosh, like as communities supporting our businesses, right? I tell you what, if our local businesses fail, we are hosed. And I loved being in the state of Texas, where there was a really robust discussion about balancing the benefits of public safety measures against their unintended consequences, which would be economic catastrophe. And so I'm so happy we live in a state where we're willing to place bets and trust people to act in kind of an enlightened self-interest and to take care of each other.
Yeah.
Yeah.
I would totally agree with that, the interdependency that we have and what that showed, and your organization, and I see Sally Huggins is on the line too, and she's with Medical City McKinney, and talking with them and their staff and what they went through, and I know Joe Minnesali, you're also on the line. I mean, we have tremendous healthcare providers in our community that worked day in and day out when we didn't know a lot of information at the time. It seems like we've learned so much from the beginning when this first happened to now. So speaking on that line too, I'm going to stay with Dr. Kerr for just another minute, because some other questions that have popped up. So just reading an article today from the New York Times, and they were talking about optimism versus caution. And they were citing some various health professionals about a potential fourth surge, a fourth wave. And that we were seeing a downtrend of new cases, and now spring break's over and we're seeing that kind of that uptick. And also with that, a much more contagious variant, they named it the B117, I guess it was first identified in Britain. Couple questions here where I'm going with this. First, are you worried about another surge, another wave, as they call it, the fourth wave? And second, with this vaccine, what do we know? Does Pfizer, Moderna, and now I guess Johnson & Johnson with their one-shot vaccine, are those going to protect us from some of these more frighteningly more contagious variants?
Great questions. Well, there's a phrase that I would love everyone to stick with, and that is, it's called trust the science, right? So we only can know what we know. And so my earlier references to the data that's only now accumulating about the rate of asymptomatic carriage in the post-vaccinated population is an example. Like, I'm going to tell you, we don't know. There's a lot of wonderful people getting all over these variants. They've all been genetically mapped. They were doing studies about how avidly the antibodies produced by the vaccine bind those variants. And so there's going to be great information about the relative protection that the Pfizer, Moderna, and J&J vaccines provide against the Brazil variant, the Britain variant, the South African variant, and whatever other variants are identified. So I think I'm not worried about our ability to, in relatively short order, determine how dangerous they are and how protective our vaccines are. But I would say this, I want the decisions that people make to be based on kind of a sober acknowledgement that we live with a lot of uncertainty, right? We know that hand hygiene, social distancing, and masking and vaccination work. And to my friends and neighbors who haven't been impacted by COVID personally, because it's the individual anecdotes that you never forget, right? And for those of us who haven't been impacted personally, it's less real. And so it's more of a discipline to follow those safety behaviors and to even go get vaccinated for some people, right? It's just a theoretical thing. But I'm telling you that the only reason we're seeing the drop in community transmission is because we're getting in front of it with vaccination. But we still need to go that, it's the third quarter. We need to finish and encourage everybody who is eligible to go get the vaccine. So my last little teeny bit about reproductive age women and who again are the people group that's getting vaccinated in the lowest numbers. The American College of Obstetrics and Gynecology and American Academy of Pediatrics have all published within the last week peer-reviewed data showing that the vaccine is safe during pregnancy, before pregnancy, during breastfeeding, and in fact, it actually reduces COVID complication, obviously, risks for people who've had the vaccine. So we can't stress that enough. Trust the science, and please don't let your position be informed by something other than objective information, right? Don't double down because somebody you don't like is doing it, right? Or somebody, that's where we run into trouble.
One more kind of quick question for you too. This question has come up quite a bit. What if somebody has had COVID? Should they get the shot?
Great question. The short answer is yes. The second answer is it depends on when. Okay, so here's what the current, and I believe it'll remain this will remain the advice. If you had COVID, wild type COVID infection, any variant, whatever, you should consider being vaccinated. If you had convalescent serum therapy or monoclonal antibody therapy. That's the bamlanivimab or those like it. Those are both infusions that you get hooked up in an IV and receive them that way. You should wait 90 days to have your vaccine. If you didn't have those therapies, you could wait at least 30 days. But wonderful question. I hope everybody takes that advice.
Yeah. So Rod, I wanted to ask you, you mentioned that the trial is not just, you go in for the addition, the initial, the shot, give feedback. You're in it for another year and a half.
Yeah.
Wow. Okay. So tell us a little bit about that. And what does that look like? I mean, do you go in someplace? Do you talk to physicians? You mentioned an app. So what does that look like?
Okay, so there's two parts to it. And now that I'm 6 months and 3 days immune now, so the scope of it's changed slightly just in the last week. At first, I have an app that they provided for me, and it prompted me every week to talk about if I had symptoms. I had to take my temperature. Basically, just they give me a little kit, and I would produce my vitals each week. Sometimes they would add on a phone call with questions, specific questions. It varied, usually it was similar to what I would hear in the app. It would be the kind of thing that, they'd be asked, have you had any symptoms? It basically was expounding on those type of things. And then I was going in about every couple of months, every like 6 to 8 weeks. And they would draw about 6 to 8 vials of blood, give me a COVID test every time. They wouldn't really tell what they were testing for. I think they probably wanted to know, did I actually contract it somewhere along the way? But lots of vials, lots of stuff. That's the not fun part of the process, but it's valuable. I mean, they need this data. And I think it shortened the amount of time it took to get the efficacy numbers and things like that. So yeah, it's ongoing. And now that I'm at that 6 month point, it's a factor now where I'm only supposed to go in once a quarter. So, and then now I'm going in, the app is only prompting me once a month. So I'm still providing that data. And if anything changes, they say contact them immediately. Like when we thought I might've been infected, I had to call them right away and they saw me immediately and all that. But yeah, it's an ongoing process. They want to know if this is safe. They want to know if this is consistently safe, consistently effective. The big question is how long does the efficacy last? And nobody knows. I think that's the samples of what they're trying to find out in our blood and find out what we got is to see if it's still working 2 years from now.
So on a more personal note, what was the feedback that you got when you called your family, talked to your friends and said, hey, I'm going to do this trial? What did they say to you?
So Amanda can reference this. She watches my social media. I have friends all over the spectrum in terms of opinion, in terms of where they sit politically, personally, whatever. I am surrounded by all different viewpoints, and I've been called everything from visionary to part of the machine and everything in between. For me, it was a two-part personal decision. Some of it was selfish, self-preservation. I knew I was going to be around a few thousand people. Part of it was altruistic, and I know that I do have a voice in my industry. I've been in my industry a long time. I have a lot of contacts. I'll have a lot of influence. And so I knew that if I did this, and I believed it. I mean, I did a fair amount of research. I talked to a doctor that was in phase 1 of the trials, and she explained a lot of, what you heard from Dr. Kerr today. And so I felt very confident about it. So my family members that were nervous, I assured them of the information I had found. For my friends, it was, like it was anything from embracing what I was doing to telling me I was crazy for what I was doing. As it became more and more, as information about this became more and more public, I think a lot of people realized, man, Rod's been doing this for quite a while. Okay, then I started getting the personal questions of, okay, how did you feel after the first shot, after the second? Now they started asking those questions, very much more specific questions as we went on. So, yeah, I mean, I've experienced it all, to answer your question, in terms of feedback, positive and negative, but I feel super confident from my perspective on what I did and why.
Yeah, so something else I think I wanted to point out, because we were on a call with both Rod and Dr. Kerr yesterday, and Dr. Kerr, you mentioned something, that a statistic that really stood out to me, which was the number of physicians on your campus who received the vaccine. Would you like to share that?
Sure, sure. So this is the home cooking data, right? So about 96% of all physicians eligible to receive the vaccine uh, were vaccinated. And so I'm sure our colleagues at Medical City McKinney had exact same data. It drops off from there with other members of the caregiving team, but boy, if that isn't a testimony to their confidence, I'm not sure what is.
Yeah, that gave me a lot of confidence to hear that. Another question. So like you said, every day we're learning more and more about the vaccine and about its efficacy rate and what to expect. So for those of us who have children, we are very interested in the vaccine, the trials that are going through right now. And I think there was some news this morning about the Pfizer, I think it's Pfizer-BioNTech vaccination and how successful it is with 12 to 15-year-olds. So can you share with us where we are with vaccines for our children?
Well, Lisa, you're going to scoop me. So the Pfizer-BioNTech, that is the Pfizer. BioNTech is their partner developer. But unfortunately, I do not have the latest. I know that it's approved for 16 and up right now, but I'm ignorant right now on the lower age groups. So wish I could give you more.
Well, I have a 5-year-old, so it's on my radar to watch for when she's able to get one. She wants one. She was very upset that mom and dad got one and she didn't get one. So
I will say this, the COVE study that I'm in did send out an email and said, if you know people that are in that younger age group, they are doing a study. So it's not really out there, public knowledge, I assume, but I know that Moderna is doing a below 18 study right now.
yeah.
And I would make a general.
Dr. Kerr, you're muted.
My apologies. I would say one comment about vaccines in children, period, and what we know in general. Our confidence level with the safety of the science of vaccination and immunity in children is even better studied in those age groups than in adults. So I do expect for the approvals, although there are different forms of rigor in the developing child. There's post-pubertal and then there's the little kiddos. I'm pretty confident that we'll see approvals down in those lower school age groups soon, and hopefully we'll have the little ones eligible before return to school in the fall, because we got to get back to school.
Okay, I looked at the clock and I can't believe that our time is already up, because there's so many more questions, I think, but maybe we can do this again and bring more people together as we gather more information and learn more. Really we are, I guess, part of history at this point. So in some ways it can be, if you look at it in that term, maybe a little bit exciting, when like Amanda said, I mean, the fact that we even got this vaccine out this quickly is just a medical feat. And that's something perhaps we should be celebrating that we were able to do. And by we, I mean the top medical and scientists and the brightest minds in our world. So first of all, I want to thank you, Dr. Kerr. I want to thank you, Rod. Appreciate your time today. I know it's very valuable, and what you brought and your perspective and your personal stories, as well as the scientific data, as you say, follow the science in making decisions. It's been just extremely valuable to our group today. So I appreciate that very, very much. There's been a couple of things in chat that I do want to point out to our group. We've got our last day for our community awards giveaway on social media. So there's some links in the chat. Please do take advantage of that. We want you to come celebrate the best of the best in McKinney. We're doing it virtually. We still feel like while we're very optimistic about where we're heading, we want to make sure that we also are doing our part in this last couple of months as we get to a better place. So, but we have a fun and interactive way that we will be hosting those awards. Also, we want to say thank you to all the frontline workers, our first responders, our medical professionals, our people who worked at grocery stores. I mean, all the people who stepped up during this time, our teachers, our educators who went back into the classrooms with not a lot of knowledge about exactly, what to expect, but they did it because they wanted to keep our community going. We are putting together a very special video. Thank you to SRS. They're helping to underwrite the cost of it. And we'll be premiering it at our community awards. But we need your help. So there is a phone number that you can call and you can leave a voicemail that expressing your thanks to those frontline workers and to the people in our community who stepped up, and we'll be incorporating those thank yous throughout the video. So we want the community to be a part of this in a more interactive way. So that's also in the chat as well. Don't forget about the testing kits that we have. If that's something that you can utilize within your office to help keep your office staff safe, or please do contact us. There's an interest form that you'll fill out. We'll get you all the details and we can get those test kits to you. They are free. And I believe I have gone over everything that I'm supposed to. I'm looking at Amanda to see if I'm okay. Good. She keeps me on track. Thank you to AEYL for sponsoring today. Thank you for all of those who participated. We will be following up with an email. Again, thank you, Dr. Kerr. Thank you, Rod. And we'll be spreading more of this information. It's really important that we get facts out there to our public and they can access that information very easily. Thank you all today. Have a good day.